Hi guys, my name is Dr. Jess Smith and this is Dr. Matt Singh. We are both emergency physicians in Grand Rapids, Michigan, and we are working to get these intubation chambers up and produced so we can get them out to as many different places as quickly as possible because we think they're a game changer. Matt's gonna describe the purpose of it, and then we're gonna go step by step through a protocol that we've come up with to safely intubate using one of these things.
As you know, there's a high risk of aerosol from COVID-19 during intubation and high risk of nosocomial infections during the procedure. This is not to replace typical PPE. We still want people to use gowns, gloves, masks, goggles, hand hygiene. This is meant to be another layer of protection against COVID. So that it works in two ways. One, as a physical barrier to protect against droplets, and two, using a negative flow and negative pressure system, it will help to remove aerosols during intubation.
When intubating, using the chamber, we're recommending taping your gloves to your gown, like so we foam tape here, but you can use whatever type of tape you have.
The patient should be placed supine and flat on the bed with a non-rebreather in place.
Place all of your necessary intubation equipment next to the patient, including your ET tube with stylet, syringe, ET tube holder, bag valve mask, suction, and direct laryngoscopy if using. If using indirect laryngoscopy, insert at later step.
Next, place the chamber on top of the patient in preparation for intubation.
You're going to want all your flaps splayed out, and then this is a step where you're going to put your connection tubing or your circuit tubing for your vent. Go ahead and get it in there. Then a trick that we found to help with your seal is to place a blanket over the top of the flaps to help keep things relatively airtight. So the next step is going to be taking your suction straight to wall suction, and then your other port is going to go to the suction nozzle on the chamber. Now, ideally, you're going to cut this to the shortest length possible. It'll still fit on the nozzle. Less than 4 feet is ideal, but the shorter you can get it with comfortably having it connect to the wall, the more suction you're going to get, or the more air movement you're going to get. Video laryngoscope is going to go through the side port.
Now you can give RSI medication and intubate the patient.
We are recommending video laryngoscopy as it improves first attempt success. However, with the chamber, you can use direct laryngoscopy and have good visualization. So tube goes in, inflate your balloon, remove stylet. What we're recommending is actually hooking it up straight to your colorimetric capnography and to the vent circuit, and give your breaths that way as you can listen, because any bagging is just going to increase aerosolized procedure. You still can bag as needed, but we're recommending try to skip that extra step and just go ahead and get it to the vent.
And make sure now to have an assistant auscultate the lungs to confirm tube placement. Also consider placing an OG at this point, as that can also aerosolize COVID.
If you miss the first attempt and you need to bag, that can be done. Just grab your BVM, and then what we've been doing is having the provider use a two-hand seal while respiratory therapy bags. So once the intubation procedure is done, you have all the manipulation of the oral pharynx that you're going to be doing with OG placement, etc. Our recommendation is then to leave the chamber in place once the patient's stable for at least 5 to 10 minutes. This is about a 50-liter chamber, and the amount of airflow that we've calculated is about 50 to 100 liters per minute. So that's 1 to 2 air exchanges per minute. If you leave it 5 to 10 minutes, that's 5 to 10, maybe even more air exchanges happening, which is going to minimize, if not eliminate, aerosols present in the chamber. Once you take it off, it can be cleaned with any cleaner that you have in the emergency department. The bleach wipes, the purple top wipes, or peroxide wipes, all are safe with the material that the final product will be made from.